Good afternoon and welcome to Insomnia and Veterans, Tips for More Restful Sleep. This event is presented by the Road Home program at Rush University in collaboration with the Zocalo Group. My name is Narajan Karnik and I'm the Medical Director of the Road Home program, which is the Center for Veterans and their Families at Rush University Medical Center. I'll be speaking to you today for the next 15 to 20 minutes about sleep and then taking some questions. If you do have questions during the presentation, please feel free to put them in the box on the bottom and we'll do our best to answer them today. So to begin with, sleep is an essential part of our lives. Good sleep affects physical and emotional health. 39% of adults report that they sleep less than 7 hours per night. Only 10% of US adults report that their sleep is excellent. And about 27% report their sleep as being poor. Poor sleep is associated with obesity, cardiovascular disease, depression, and anxiety. And relevant to this talk and this presentation today, veterans report significant sleep problems. This could be due to post-traumatic stress or traumatic brain injury. In a recent study that we did here in Chicago, veterans under the age of 50, about 15% reported that they had sleep problems, and 16% reported that they had post-traumatic stress symptoms. Most of these veterans told our surveyors that they avoid seeking care because it is expensive and takes too long. One example is, one of our veterans that came for treatment at the Road Home program was a Vietnam vet who had served multiple rounds of duty. He reported significant nightmares related to campaigns he was in. He often wakes from these nightmares and finds it difficult to get back to sleep. As a result, he's constantly fatigued, has difficulty with focus and concentration, and is exhausted all day long. In consideration of this, let's take a little bit of a deeper dive into what sleep is and talk a little bit about the normal cycle of sleep and also its relationship to trauma. Trauma and sleep are related in a variety of ways. So post-traumatic stress can cause nightmares. There can be difficulty in physically getting comfortable. People who have post-traumatic stress or have trauma in their backgrounds often feel physically uncomfortable. They can have pain, they can have a variety of symptoms that emerge from the experience of having suffered trauma. They also, in general, have higher levels of anxiety and stress, and that again can make it difficult to fall asleep. Finally, individuals who have trauma in their backgrounds can feel unsafe in some environments. They can, to some extent, feel threats where there may not be any, and that can make it difficult to get a restful night's sleep, especially when it's dark, you hear noises outside, you're not quite sure what those are. That can make it difficult as well. This all impacts what we would term our normal sleep-wake cycle. So this sleep-wake cycle is a mixture of what I would term inside and outside factors. Factors within our bodies, factors out from the outside environment. The graph that you're seeing shows the normal sleep-wake rhythm. This roughly matches to a 24.5-hour on average day-night cycle. So you're going to say to me, that doesn't make sense because we're awake for 24 hours out of the day. So why would there be a 24.5 day-night cycle? Well, our bodies aren't quite programmed according to what the Earth revolves around. And so our body actually has a mechanism for resetting its clock each day, and that's called the suprachiasmatic nucleus. This little space in the brain helps regulate our sleep. The graphic that you're seeing now shows the way in which the suprachiasmatic nucleus works. Light enters through our eyes and triggers the suprachiasmatic nucleus, so that center in the brain, to release a series of hormones and responses. These hormones include things like melatonin. The biological factors are also impacted by temperature. Also, our stress hormones like cortisol fluctuate during the night. And cortisol as a stress hormone can get disrupted by trauma or post-traumatic stress. So these things all tie together in an elegant system, and they have to sort of work in order for us to have good sleep. Anything that disrupts sleep on one side or another can cause difficulties. So the earlier graph I showed you examined the sleep-wake cycle and showed different layers of sleep. So there can be lighter sleep and there can be deeper sleep. And both of those types of sleep are important to get. I'm going to talk a little bit more about how we can get better sleep or better quality of sleep in order to make our sleep more restful. So let's move to talking a little bit about things that hurt sleep, things that make sleep difficult. So one thing to consider that's commonly disruptive of sleep is alcohol. Now, a lot of people who drink alcohol will tell me, well, alcohol makes me get sleepy, makes me tired, and that's good, right? Well, on one level, yes, alcohol can make you tired. The difficulty is that alcohol doesn't let you go through those full cycles of sleep, that up and down rhythm of sleep through the night. Alcohol just puts you into that sleep state initially, but it doesn't really give you what we would say is the architecture of good quality sleep, because you're not getting the full cycling that you need. Similarly, tobacco, it can act as a stimulant. I understand, people who smoke tell me that, tobacco smoking relieves my anxiety. I understand that. But on the flip side, it can act as a stimulant and keep you awake. And so that quality to sleep really, or that impact on sleep can make it difficult to get good quality sleep, especially if you're smoking close to bedtime, smoking, early in the morning or late at night, times when people go into withdrawal from nicotine, they might feel that more. The third factor that can hurt sleep is light. So right now I'm sitting in front of a computer. The type of light that comes out of the computer is called blue light. And that blue light actually enters our eyes. It to some extent mimics the same type of light that we have with sunlight. And so that same process I showed you earlier, where light enters through our eyes and hits that center in the brain, that's what our bodies sometimes can perceive ongoing light from a computer as. Any type of screen, like a computer screen, a TV screen, puts out that type of blue light. Interestingly, there are some devices, iPhones and iPads that put out blue lights, but some of these smaller devices, like a Kindle that has that e-paper quality to it, don't seem to put out blue light. The quality of that light is different and may be slightly better in terms of its impact and may allow for better sleep. So the lesson and takeaway is don't use your computer or your iPad or your iPhone before you go to sleep, but the Kindle, maybe you can, or at least use it sparingly. Finally, one thing to consider is eating too close to sleep time. Eating too close draws energy from the body. So when you eat, your body has to digest the food, and that can absorb energy that you need to go to sleep. And so eating too close to bedtime can interfere with sleep and hurt sleep. So you want to try and eat, a little bit earlier, give your body a few hours to digest some of the food initially, and you're probably likely to sleep better. So as an example of things that hurt sleep, one of the veterans that we treated previously, who had served 3 tours in Iraq, he had lost 2 of his best friends in battle, witnessed one getting killed. He had recurrent problems of sleep and nightmares, and the nightmares focused on witnessing his friend die. By the time we saw him, he had taken to drinking significant amounts of alcohol each night to get to sleep. And we really had to kind of work with him to reduce the amount of alcohol that he drank. And the quality of his sleep started to improve, and he started to feel a little bit better. Because poor sleep just, it cycles into just poor days as well. So on the flip side of things that can, from the flip side from things that hurt us in terms of our sleep, there are things that can help us in terms of sleep. And the first thing I want you to think about is temperature. So keeping a room cooler and sleeping under a warm blanket are sort of a good setup for better quality of sleep. I learned this pretty poignantly when I was actually in medical school and was treating a woman who was pregnant. And she was well into her 3rd trimester. And she came in for a routine appointment with her obstetrician, and I was working in the clinic that day. And she told me how she was staying with her in-laws and was in the final weeks of her pregnancy. And her in-laws were an older couple that routinely kept the temperature in the house at around 72 degrees. And every night, this woman would spend most of the night trying to get comfortable and having little success. I basically just looked at her and told her, look, you're the mother of their grandchild, you should tell them what you need is a lower temperature, and anything else you need, better pillows, better blanket, whatever you need. And she kind of looked at me in a little bit of surprise and then laughed and said, you know what, that's what I really need to do. And she went home, she followed up the next week, came back in and said that she had been sleeping much better, that the in-laws immediately turned down the temperature, they wanted to make sure she was comfortable. And that contrast between cool temperatures outside and having a warm blanket over us really does help promote better quality of sleep. The second factor to consider is light. So you want to consider dimming lights through the evening. Basically, you want to kind of mimic sunset. If we didn't have artificial light in this world, we would all be relatively in the dark during the evening hours. And that actually helps our mind and our brain start to cycle down and move into that sleep phase. So you want to consider dimming lights to mimic that. You want to avoid TVs or computers before bedtime, as I said earlier, because that light is that blue light, and that blue light mimics the sun. The third element is that you want to try and keep some type of structure. So this is really in promotion of that sleep-wake cycle. You want to have a relatively even sleep time and wake time. The reason for keeping to that, and I treat a lot of adolescents as well, they have a really hard time with this, because come Friday, they want to stay out late with their friends, and then they sleep in on Saturday, and they sleep in on Sunday. And then Monday morning, it's very hard for them to get up. Because as you let your sleep time shift, you're basically producing a type of jet lag. The distance between New York and Los Angeles is a 3-hour time zone difference. So if you go to sleep 3 hours later on Friday night and wake up 3 hours later on Saturday morning, you're putting yourself in a situation where you have a 3-hour jet lag that you're going to carry into Monday morning. So imagine if you do that every week, it's not going to be a very good pattern for yourself. And talk to people in your lives who might travel, talk to friends. If you know anyone who happens to be a pilot or a flight attendant, they can probably tell you that jet lag is not a very easy thing to get over, no matter how long you do this. And it's just not healthy for our bodies. So try to keep the same sleep time. Go to bed at 10:30 each night, get up at the same time in the morning. Even though you might not have a lot to do on the weekends, if you reduce that jet lag, you will feel better. So I next want to talk a little bit about sleeping medications, because I get asked to write prescriptions for sleeping medications quite often. Now, sleeping medications usually work the first few times you use them, and then they generally start to wear off. Why is that? Well, our bodies become tolerant to most of these medications. So these medicines can work for a time, and then, basically we get used to them. Medication-induced sleep is never as good as non-medication sleep. In other words, it doesn't produce that same architecture, those cycles that I showed you earlier. Medicines can't reproduce that in the same way. And so they don't have the same restorative abilities that we need. And that kind of quality of the sleep is not as good. And finally, when medicine is stopped, you can have what's called rebound insomnia. So if you've taken sleeping medication for a long period of time, all of our body's sort of natural processes for helping us get to sleep, the melatonin in our bodies, the sort of cycling of the cortisol, things like that, start to shift and change and reduce, because our body senses that those things aren't needed because you're taking this other agent from the outside. So if you stop that agent, those things don't come on like a light switch. It takes time for those processes to restart in our bodies. So that's why medications don't work well over the long term. When I use or prescribe medications for patients, I tend to give it to them in short periods of time, to use for just a couple days at a time to sort of reset their sleep clock. But I rarely ever, if ever, tell patients that they can take these medications over the long term, because it just doesn't seem to be as effective. So what are some things that you could try at home or on your own? First, do the obvious things. I outlined above why alcohol isn't good, why tobacco, and even caffeine, if you take caffeine late in the evening, those can be troublesome things. Those are relatively easier things to shift. Can you reduce the alcohol? Maybe just, not drinking as many drinks as you drink each night. You can kind of cut down by 1 or 2 and see how the quality of your sleep works. That might be one strategy, an easy strategy to do at the first take. Second thing is reducing the amount of tobacco, cutting back a little bit, and shifting caffeine so that you're not drinking it after, say, dinner time. The latest caffeine, when I'm working with folks who are having sleep difficulty, I tell them don't drink any caffeine products after 5 o'clock. Second thing to try is the temperature. As I said earlier, reducing the temperature in the room, using a fan or keep a window open. Whatever you can do to keep the room cooler, and then have a blanket. In the middle of the night, as our cortisol levels shift, our bodies actually start to get warm. And so you want to keep the temperature cool enough that that doesn't become uncomfortable, because that may be something that will make you wake up. Third thing to try is taking a warm shower before bedtime. Not only does a warm shower relax your muscles, it actually slightly increases your body temperature. And again, you're creating that contrast between the warm and the cold that should help you sleep a little bit better. If you're still having difficulties after these rather simple techniques, you may want to consider one of the applications that we have on our landing page on this webinar. So there are 2 that are relevant to the topic today. One is an app called CBTI. So that stands for Cognitive Behavioral Therapy for Insomnia. And it's a sort of coaching program developed by the VA hospital in Palo Alto. And it basically will walk you through stepwise how to reduce your anxiety around sleep, how to address sort of thoughts you might have that might be getting in the way of getting good sleep. And it's all designed within the application. The application's free. You can download it from the App Store. And you can give some of the techniques in there a try. And the app is meant to be used as you're sort of cycling down towards bed at night. The second app that's on the landing page is called PTSD Coach. And that's meant to help address some post-traumatic stress symptoms. And again, developed by the VA, free, give it a try. Consider treatment, if the post-traumatic stress symptoms are continuing to get in the way. If you're having nightmares and those issues continue on, you may want to come in and get some treatment. And if you're in the Chicagoland area or in the Midwest, the Road Home program might be a good resource. If you're not sure about who might be available in your areas, you can reach out to our program staff and be happy to connect you to some of the other programs or providers that we work with across the country. So I want to thank you for joining us today for this webinar. This is a sort of first attempt for us in using this type of forum to do this type of education. We really would welcome your feedback and also your thoughts. If you want to post on some of our social media on Twitter or Facebook about thoughts that you've had about this event today, or ideas you might have about topics that we should cover in the future, we would be most welcome your feedback. I'm now going to take some questions. You can address the questions in the box below. And I know some of the participants today had posted questions earlier, so I'm going to try and go through them in a stepwise fashion. So the first set of questions seem to revolve around anxiety. People were asking, are anxiety attacks associated with sleep disorders? Another individual asked, what can I do to stop extreme anxiety and panic attacks at night? So anxiety and sleep disorders do go together. The more people have sleep difficulty, the higher level they will have of anxiety. And if they have panic attacks already or a tendency to have panic attacks, they can certainly have additional panic attacks. And anxiety can also make it difficult to sleep. The irony about sort of sleep dysfunction is that people often sort of sit there and they're anxious about getting to sleep and therefore they don't sleep. And that cycle kind of continues and feeds on itself. So what can you do at night? I would really suggest that you try the CBTI app that I mentioned just now as a first step. That technique is really designed to help address some of the anxiety around sleep and help you reduce that. It's a good first step. If that doesn't work and if you continue to have difficulties, I think then that might be a reason to come in and see someone and sit down with a therapist and kind of talk a little bit about what might be causing the anxiety or where it might be coming from. Is it coming from post-traumatic stress? Is it coming from other sources that cause anxiety? And anxiety is really common, and it's actually really quite treatable. Psychotherapy works really well for certain types of anxiety. There are some medications that can help with anxiety, and we'd want to kind of think a little bit more deeply about that if the kind of preliminary technique that I described here doesn't work well. The second set of questions all revolve around dreams. Some of the individuals who wrote in said that sometimes they have bad dreams and they try to wake themselves up, but they can't and they feel stuck. Another individual wrote that why do some dreams feel so real? And do they have a meaning? I'll try and address just some of these kind of general themes that are in here. So the getting stuck feeling, actually, I've had several patients who told me that they often feel like they wake up in the middle of the night, they sometimes can't move, it feels like their body's kind of stuck. These are what are called hypnagogic reactions. So this is sort of reactions that happen in the space between when we're awake and when we're asleep, or vice versa. That there's a transition period when you go from being either fully awake to being fully asleep, or going from sleeping to waking. And those transitions are times when we can really feel odd sensations, because it's almost like our bodies aren't fully online. It's like part of our brain is getting booted up, but the rest is still offline. And so it takes a little time for all the systems to come together and come on board. And so one of the techniques that we talk about, people trying to do are what are called grounding techniques. So getting a sense of feeling from your other senses as to what's going on around you. And then that helps sort of integrate the experience so that you won't feel like you're stuck. If it continues and if it doesn't get better, then that's another reason to come in and see someone and talk about it, because we want to get more of the history, kind of understand what other factors might be involved. So dreams in general, people want to know how to turn dreams off. Can I shut them down? Can I turn my brain off? You know, dreams are a necessary part of our sleep. If we don't dream, we're actually not getting that good quality sleep that we need. Now, dreams can be upsetting. Nightmares can be very upsetting. There are certainly causes to those aspects of dreaming, and we certainly don't want people to suffer with those. So there are ways to treat dreams. There are things like directed dreaming, where you can actually kind of think about your dreams and sort of set them emotionally a little bit before you get to sleep to help them sort of move in a certain direction. You can't sort of pre-program dreams, and you can't really shut dreams off. Because again, that doesn't allow you to have the full quality of sleep that you need. There are some medications that are used to treat nightmares specifically, and those can actually help. They've been shown to help individuals with post-traumatic stress. In terms of sort of, some veterans report that they sort of act out physically when they're dreaming, sometimes responding to things in their environment. That's certainly a reason to come in and see someone, so we can work on that and help reduce the intensity of that. Those dreams are really, perhaps most dangerous, both to the individual, the veteran who's sleeping, but also to their spouse or partner who may be co-sleeping with them. And having really bad nightmares at night can really make you feel exhausted and tired. So it's certainly a key area that we want to address. I'd suggest if you want to try the CBTI coach that's online and the PTSD coach, or both, and explore those as first options. See if those techniques help. If they don't, then it would be a good reason to reach out and help us to help you get connected with someone who could work with you a little bit more. So another set of questions are about how do I stay asleep and how do I fall asleep? So staying asleep can be very difficult depending on what's waking you up. Is it because you had to go to the bathroom? Is it because you're having nightmares? Is it because, again, the temperature fluctuations in the room? So you want to try and figure out what works well for you. When there's a night where you sleep really well or sleep through the whole night, try to kind of piece together or write down what are the patterns. What did you do that day that really set that in motion? Oftentimes people wake up because they have a lot of thoughts in their minds, they have a lot of anxiety, and they sit there kind of thinking about things. And in this era, I think people reach for a computer or an iPad or an iPhone and kind of turn on that light in the middle of the night and put it in their eyes. And again, that's really counterproductive. That's not something you want to do. You want to try and keep the lights off. You want to try and calm the mind, relax. the CBTI coach will give you some techniques as to what you can do to try and reduce the anxiety that happens when you wake up in the middle of the night. There's a question here about CPAP. So CPAP is a machine that people who have obstructive sleep apnea use. And the individual wrote in asking, what can I do if my CPAP machine wakes me up? So these machines sometimes can make noise. The best advice I can give you without, again, knowing the details of your case is that there are so many types of CPAP machines now available, it would probably be worthwhile to go back to your doctor who prescribed the original machine and see if they can get you a quieter machine or get you a better mask that will fit better. Obstructive sleep apnea is a very common disorder now, and we have a host of treatments for it. The machines are one. Sometimes there's some surgical treatments that people can do to help make the breathing better. Oftentimes, actually, some sleep problems which are ongoing result from the fact that the individual has not been diagnosed with obstructive sleep apnea and hasn't had a good sleep assessment done. So that, if you have symptoms, one of the key symptoms around this is loud snoring, and that results in non-restful sleep. So people who snore loudly aren't getting good passage of air in and out of their bodies, and that can be one kind of rough indicator of sleep apnea. So if you share a bed with someone and you hear them snoring really loudly, and it sounds like they're at times kind of stopping breathing, the body will wake up. The body will respond to that and sort of go into its emergency mode and say, wake up. And people who have obstructive sleep apnea often don't even realize that they have woken up multiple times in the night because they're not breathing well. And it's a highly treatable condition. So often I have had patients who have symptoms of depression, anxiety, who actually had underlying sleep apnea, who get much, much better once we treat the sleep apnea. So there are a host of other broad questions that have come up. One's related about pain and insomnia. Pain is something, physical pain, emotional pain can both cause insomnia. The key to that is trying to address the underlying cause of the pain. That can take time. I mean, to be honest, to be fair, it can take a lot of time. How does lack of sleep affect the psyche and the body over the long term? Well, sleep deprivation, they've done actually experiments with sleep deprivation. I actually had a friend in college who signed up for one of these studies that I guess NASA was doing. She agreed to stay in a lab and not go to sleep for 2 weeks. And they did this for a series of individuals and sleep deprived them over that period of time. And what they found was that individuals basically became somewhat delirious, even psychotic, started imagining things, seeing things. Their bodies took a significant toll. Almost everyone who was sleep deprived for that period of time lost immune function and started to get colds and flus at a higher rate. It had effects on their breathing, on their cardiovascular system. Almost every organ system in their body is impacted by long-term sleep deprivation. So from my perspective, one of the keys to good mental health is good sleep. And it's one of the big targets that I have to work with folks who come into my office, is making sure that they're getting good sleep, making sure that the children and adolescents I work with are also getting good sleep. Children and adolescents should sleep better than adults, should sleep longer and more consistently. As we get older, our sleep does tend to get more fragmented. Another individual is asking, what can I do if I can't wake up by myself using an alarm clock or other methods? They always have to have someone wake them up. That may indicate that you're just not getting good quality sleep. This would be an indication for me to take a really good detailed sleep history. I'd want to know, is this person potentially having sleep apnea? And so they're not getting good sleep, and so it can be really hard to wake up in the morning. They're so tired, they just can't wake up. The other thing that we're finding is that there are, on that cycle that I showed you before, there are better times to wake up and times that you don't want to wake up. If you can catch on the sort of tail end of a cycle that's coming up out of the deeper sleep, it's actually a better time to wake. So that there are actually devices that are coming out on the market now to help us with that, alarm clocks that pick up what our sleep rhythm is and try to anticipate when to wake us up. Finally, I'm going to take one last question here. That there's a question about cognitive therapy and does it work long term? The answer is Yes, the data shows that cognitive behavioral therapy for sleep does work well over the long term. It results in skills and normalization of sleep that can be really beneficial. And that CBTI coach is a good first step if you want to try that out a little bit on your own. So for those of you who stayed with us, I want to thank you for joining us today. It's been a pleasure spending a little bit of time with you. And my team and I look forward to doing future events like this. Depending on the topics that you suggest, we'll try and make them happen if we can.